Good afternoon, everyone. Thank you for joining us again for our Chinese friend, Xinyan Kuai La. I hope you got that. I got that right. And for all our Filipino friends, happy Valentine's in advance. Alam ko excited kayong lahat for tomorrow, lalo na sa 15th. Okay? So, for this afternoon, we will be discussing about heartworm prevention. Is it an option or a necessity? I am Dr. Ivy Alvarez, and along with me is Dr. Gil Shalsita. We are from Animal Wellness Veterinary Hospital and Clinics. So, what are your thoughts, Dr. Gills?
Heartworms are one of the most uh, devastating parasites that your dog can have, and I think it's a necessity, definitely.
I agree with you. So, let's learn more about heartworm. What are heartworms? So heartworms, can we have that? Most probably we can, no? But these are parasitic worms called Dirophilaria imitis. That's their scientific name. And then they can grow up to a foot long. So this much heartworms, you can see them in the heart of an infected dog na severe ang infestation, heart and lungs. So this heartworms in one cup might be only from one dog. Okay? So ganyan kagrabe ang devastation. Can you imagine if it goes to the heart and the lungs of your dog? Okay? Not only that it affects the heart and lungs, it can also affect the other vital organs of the dog. Right,
So
Dr.
one,
Gibbs?
yes, very much so. And a dog with that much heartworms will definitely be having problems coughing, breathing, and one of the most common questions we get is how heartworms are transmitted, and they are transmitted via our common mosquitoes. Now, people will worry, oh, these are the same mosquitoes that bite us. So, can they live inside humans? What do you think, Doc Ivy?
There are some necropsy no pagtao, necropsy humans. I know autopsy humans na may nag-positive for heartworm. But then heartworms are not typical for humans. It may, in fact, it may lodge in the hearts of humans once they age. Para rin tayong cats. But then different lang yung effect in terms of because humans are bigger than cats. So most of the time, they are parang pag nag-autopsy, they can see some of this na in some affected humans.
There we go.
Dr. Gills?
Sorry. Yes, technical difficulties. So, adults live in the heart, lungs, and associated blood vessels of an infected animal. So, like we discussed, both dogs and cats can get heartworms. They just have different types of heartworms. This it's more heartworms are usually found in the area in between the heart and the lungs that connects them, and that's why a lot of dogs with heartworms will cough.
Okay. How are dogs tested for heartworm? They are tested by using antigen test kits. This is easy and it's more accurate than doing the direct blood smear. Direct blood smear, sometimes, if it's not differentiated by Knott's technique, we might think that a relatively same looking tapeworm might be mistaken for a heartworm. So it's better for us to just go do the heartworm antigen test. But then, if they are positive for this, we still need to do the microfilaria test by microscope. Okay.
Yes, the antigen test can detect up to one adult pattern, and you have to remember in the direct examination, you get a very little amount of blood in terms when it comes to the size of the dog. So a lot of them become false negative. Okay, so it's very difficult to detect.
Oh, I'd like to share also, Dr. Gills. Remember, we mentioned that a mosquito can transmit heartworm. So if they bite an infected dog, tapos na may sumama na larvae or very tiny baby heartworm to that sucking, and then it gets transmitted to another dog. That timeline, no, from the time that the larva is transmitted to a new dog to the time that the heartworm becomes an adult is estimated 6 to 7 months. So that is why it is important that even with the first prevention, it is still best to do the heartworm testing. Okay. So when should my pet start heartworm prevention?
Usually, as early as 3 months of age, we can begin heartworm prevention either through monthly or yearly. But at this point, when they're very young, the yearly treatment.
Dr. Gills, there's technical difficulty. So what is it when they are young?
The dose of the yearly preventative is dependent on the weight of the dog. And since the weight changes very much during the first year of life, it's going to be more often than once a year. So it's usually 3 months, then 6 months, then 1 year of age.
Okay, so again, they can start as early as 3 months old. Okay. So why do we need regular testing? My dog is on a regular heartworm prevention. Oh, di ba? We see these faces. Sometimes we do the prevention, tas galit na mag-retest. It is important. Again, the prevention, though it is very effective, but for instance, we gave the oral dose, and this oral dose was vomited by our dog. Do you think it's still effective? Or if we do the spot on and our dog starts to scratch its back on the wall or on the carpet, do you think it will still work? So missing at least one heartworm preventative, if you're doing it on a monthly basis, can actually make your dog become infected again if there is a mosquito that will bite, an infected mosquito that will bite our dog. Or for instance, we're doing the once a year heartworm treatment or a heartworm prevention. Pag kinagat ng mosquito ang dog, and then our naglapse na ng at least few weeks, then our dog might still get infected. Um, Heartworm in the Philippines is very common. Here in Cebu, it is present, also in Dumaguete, as well as in Manila and most parts of the Philippines. There is a company that actually did a testing for this one, and then along with some of our colleagues, and we were actively giving some of our samples, and we found out that most of the Philippines is heartworm positive.
It's funny you should mention the lapsing. No? So
Mm-mm.
for those dogs that are on a monthly preventive, 1 or 2 days that you miss, that you go a little too further, can put your dog at risk. No?
Mhm. And we've seen this, right, Dr. Gills? Yeah. So yeah, we can see this face also. So our option, annual or monthly heartworm prevention. What's your option, Dr. Gills?
The annual prevention has a lot of advantages. You don't have to be reminded every month, and you don't have to do it exactly on that day. So it can be scheduled with vaccines, and uh, owners tend to be more easily reminded about this yearly heartworm prevention. And we've been having very good results with that annual prevention. Wouldn't you say, Doc Ivy?
Yeah, this annual prevention, it's once a year injection for our pets. And it's given subcutaneously, so it's not that painful. Though we need to use a bigger syringe so that all the medicine will flow, no, inside the body of the pet. But then, if our pet is less than 1 year old, they are recommended to have a repeat at least once before they turn 1 year old, because again, our dog keeps on growing. So, in short, that dosage might not last a year. Once they are 1 year, then that's the time that we repeat it annually. For the monthly prevention, there are a lot of monthly heartworm preventatives that are very palatable for our pets and it's easy to give. As long as you find the time, no, na same day every month or for every 30th of from the time that you give the prevention, you give the medication, then it's a good alternative as well. But do you know before this monthly preventative started, heartworm prevention is once a day. So we are very lucky as pet owners now, right, Doc Gills?
Yes, very much so. Another advantage of the monthly heartworm prevention, it's usually bundled with a um, broad spectrum dewormer. And that is an advantage for clients that have a high worm population in their area. And it is a very good uh, alternative as well, as long as it's done on time.
As an add-on to that, Dr. Gills, this is there is also another brand that has the heartworm prevention slash it has the dewormer slash it also has a tick and flea prevention. So
Yep.
you just give it once and then all these parasites can be prevented. 'Di ba? Masarap, isang beses na lang. Okay?
Uh, Before we move on, if anybody has any questions, please do write it down in the chat so we can answer them. Uh, we're here to try to give more light to what heartworm is. So please ask your question.
Yeah. Oh, before we proceed, heartworm, these are the worms in the heart and in the lungs of our dogs. So it is different from the intestinal worms. Just to be clear, no, because we mentioned that one of the products it can also kill other worms. So this one, or what we are discussing right now, are the worms that are specific to heart and lungs of dogs. So the cats, ito pala ang maganda na nabasa ko. The cat's heartworm is relatively related to the dog's heartworm. So when an infected mosquito bites a dog and then it bites a cat, that cat can get the larva of the heartworm. They are atypical hosts. They are not the hosts for heartworm, but some cats can have adult heartworms. Um, 1 to 3 adult heartworms inside a cat's heart can actually kill them compared to the dogs. Even if 100 is there, they don't easily die. But the thing is, they get really tired, and at the same time, they will have difficulty in breathing. So parang coughing every night na parang parang ganun yung effect niya. Okay? So, galing ba, Dr. Guess, para pang aso? Yeah.
Big Doberman or something.
Okay. Now that's the sound. Okay.
Okay, we have the first question. Yeah, put it up on screen. What is the best monthly heartworm that can be given orally?
You
Well, the
mean
good news
brand?
is there are a lot of options,
Yes.
and they are very safe. So you are able to choose which is easiest to give your dog.
Mm-hmm.
Not, some dogs will like one brand, and others will like another because of the palatability. So it becomes a point wherein what exactly you want to give. Like Doc Ivy said, if you also want to get rid of ticks, it's also good to get that option. There's also one that's intestinal wormer plus heartwormer, which is another option. So there are a lot of options, and they're all very good.
Mhm. What we would recommend is that you talk to your veterinarian so that you can discuss the advantages as well and the benefits of the product. Thank you, Periwinkle, for that question.
Here, one of the
And ito, myth
favorite.
busted.
Yes. Oh, my dog has long hair. I won't get heart. My dog won't get heartworm.
Yeah, because the mosquito apparently cannot reach the skin of the dog.
Um, and not. I've had mosquitoes bite through jeans, and then a little bit of extra hair will not stop them.
Yeah.
So yes, even long hair, even curly hair, straight
And
hair.
Yeah, remember there are parts of the body of the dog that does not have that much hair. Yeah, and yun yung mga openings. Another one, indoor pet will never get mosquitoes.
That's also not true. We get
Yeah.
bitten by mosquitoes inside the house that's
Yes.
um, completely protected, so our dogs will also get.
Yeah, even if your house is screened, sometimes meron pang isa, dalawa, 'di ba? Usahay tulo ka mosquitoes inside your house and your house has full screen. So it's not impossible for mosquitoes to get indoor. Okay? How about aspens? They will never get heartworm. Is that true?
Not at all. They also have heartworm, and they also suffer from the same
Yeah.
fate.
But sometimes, what we often hear is that, dugay na gali ko kakitaan na niya. 5 years na siya gihapon. 5 years na, same dog. But what we don't know is that we are seeing already the nth generation of that aspin. Pareha lagnaw, no? Same look, okay? And then, ito, how about this one? My dog only needs one treatment, one prevention for heartworm.
Okay. Uh, Most preventatives are good for the month because they are designed to be slowly released throughout the body. And by the end of 30 plus days, depending on which preventative, there's not enough chemical in the dog's body to prevent the heartworm. In other words, in other worms, for that matter, to enter the dog. So it's very important to be on time every month or every year.
Depending on your heartworm. Okay? Ay, mosquito-free ang ako ang dog. It will never get heartworm. How about this, Dr. Gills? Have you heard
Well,
of this?
dogs will get into places. They like to go into the labada, wherein it's nice and wet, and then there might be a container that has water, and mosquitoes will find a way into that water and uh, start breeding. So it's in our country, it's very difficult to be mosquito free.
Yeah. So, another trivia of this one. In the US, which is a temperate country, do you know that all 50 states are positive for heartworm? Because during the time of Hurricane Katrina, a lot of dogs were adopted to different states, and that's when heartworm spread in in their country. How much more for a tropical country like ours that there's a lot of existing mosquitoes and they breed really fast, no? So it's still safer to just spend for heartwormer and testing for our dogs.
Yes, very much so. It's also the movement because the world has become, well,
Mm.
before COVID, it was much smaller and people would travel with their dogs, and
Mm-hmm.
those dogs would can get infected with the different parasites, and then when they go back to their countries, they transmit those. Here's another question, uh, Carrie Winkle.
Ang ako a question, asa cheaper, monthly or annual? Nice question. Personally, annual is cheaper if you divide that to 12 because it is given once, but then the protection is 12 months. So in short, if you have that budget for the annual, me personally would rather take that annual. But then if I also want prevention for the worms and at the same time tick and fleas, then I would go for the monthly na together na silang tanan. How about you, Dr. Gills? What are your thoughts about this question of periwinkles?
Again, it depends on the owner, the client. I see a lot of advantage in treating ticks, worms, fleas, and heartworm all in one, or preventing them all in one. Uh, Me personally, I agree with you because I will not be able to make sure that it's exactly on time all the time on that day. So I like the security, the month, the yearly preventative.
And it's easy to remember. Ay, 1 year na di ay. Na? So anytime you look at the vaccination cards of your pet, na din na. Okay? Treatment. What and when to give. Okay. Treatment for heartworm is medyo ano siya. If our pet is on the first or second stage of heartworm,
Mhm.
then treatment is still useful for them. For the third stage, meaning the signs are already very pronounced, and especially for the fourth stage, the treatment is an option. So, meaning if this is a long term treatment before we start killing the worms, because if the worms die prematurely inside the heart of our inside that area where the heart and the lung is connected, it can actually cause an emboli, and that could cause the immediate death of our pet. So the treatment option for our pets for heartworm is much much more expensive than 5 to 6 year prevention, right, Dr. Gills? Around that much.
Mhm.
Yeah, plus it's long. It's not really that it's not that comfortable. It's well, if you choose between the treatment and the prevention is definitely the best choice. So that's what I think.
Yes, when you give the treatment via, there are two options. One's a macrolytic lactone,
Hmm.
and the other one is an injection via the long muscles at the back. So the injection is considered chemotherapy
Hmm.
because the medicine is so strong. And usually we require the dog to stay overnight in the hospital so that it can be
At
monitored.
least. Hmm.
Yes, at least one day overnight for the first injection, and then 2 nights for the succeeding injection. And as soon as your dog is diagnosed, what Doc Ivy mentioned, the pulmonary thromboembolism, wherein part of the worm breaks off and gets stuck in one of the blood vessels, is a very real risk that can happen without warning and absolutely anytime. Okay. The other option, although it's not recommended anymore, it is only to be given if there are no other options. For example, your dog is in stage 3 or 4, like Doc Ivy was saying, is a monthly preventative for at least 1.5 to 2 years.
Hmm.
And the way it works is it kills all the babies, the microfilaria, every month until the adult dies off. That's why it takes so long. It takes 1.5 to 2 years, which is the average lifespan of an adult heart.
Yep.
So either way, it's not going to be easy. They do not recommend the monthly preventative as treatment for heartworm because they have found that the the area where the heartworms reside enlarge greatly if they're given a monthly preventative as well. So it's only if there's no other option. Anything else, Javier?
I think we're good. Yeah, wow. So you can also visit us in our Robinson's Galleria branch, basement 2, and our nearest parking is parking 1G. Just take the escalator and we're one flight down. So, do you have more questions about heartworms? Why heartworms, Dr. Gills? Because it's the Happy Hearts Day tomorrow. So, we want our pets to have happy hearts.
We don't want our doggies with a broken heart.
Because of heartworms, or our cats to be infected with heartworms, or us to be affected by heartworm. So I think Dr. Gills, siguro clear because wala na ibang question. Periwinkle, do you still have questions?
Yes, please ask any questions. We can
Yeah.
answer if you have any other questions. If you have, yes, and a special mention pa si Doc Gama. Uh, Yearly daw ma-inject.
Oh, good.
Ta-da. All right. Thank you very much for everybody watching in.
Oh, my
Yes.
dogs were given annual heartworm vac by Doc Gamma. Thank you, Periwinkle, for being such a good pet parent to your dogs that you remember to have the heartworm preventatives as well, with recommended vaccinations. Good job. Okay. Thank you so
Thank you
much
very much.
for joining us this afternoon, and hopefully you can join us again in our succeeding lectures. Actually, this is like interactive na activity for pet parents, so that when you have questions, it's easy for you to ask doctors like us. Okay, thank you, and we'll
Thank
see
you.
you. Bye bye.
Bye.